Hello and welcome. Let's talk about chronic pancreatitis. So what is chronic pancreatitis? Chronic pancreatitis is a progressive inflammatory disease in which there is irreversible progressive destruction of the pancreatic tissue. Its clinical course is characterized by the severe pain and in the later stages, exocrine and endocrine pancreatic insufficiency. It occurs mainly in the male and onset of the age is about 40 years. Now, causes. Chronic alcoholism is the main causes, and pancreatic duct obstruction, congenital abnormalities like pancreas divisum, annular pancreas, hereditary pancreatitis, infantile malnutrition, and idiopathic may be the causes. Hypercalcemia, hyperlipidemia, tropical pancreatitis, and autoimmune pancreatitis are other causes. Now, pathology. At the onset of the gland is normal, but it later enlarges and becomes hard as a result of the fibrosis. The duct becomes distorted and dilated. Calcified stones are present. Duct may become occluded with gelatinous, proteinaceous fluid and deformed ducts. Histological, there is ductular metaplasia, atrophy of the acini, and hyperplasia of the duct epithelium and interlobular fibrosis. Now, clinical features. Chronic pancreatitis may be asymptomatic or it may present with the pain in the subcostal region and the back and may radiate to shoulder, sometimes diffuse. Nausea and vomiting may be present, and all the complications of the acute pancreatitis may be seen. Weight loss, malabsorption, features of the diabetic mellitus may be present. Now, investigations. Raised serum amylase may be seen in the early stage of the disease. Pancreatic function tests like secretin and CCK stimulation test. Test to detect diabetes mellitus can be done. Elevated serum bilirubin or alkaline phosphatase due to fibrotic biliary obstruction can be seen. Abdominal X-ray may be done with such pancreatic calcification, and ERCP is the most accurate for diagnosis of the acute pancreatitis. Other imaging studies like CT scan, MRI, and MRCP can be done. Now, treatment. Medical treatment includes treating the addiction by patient, helping the patient to stop the alcohol consumption and tobacco smoking, and involve a dependency counselor or a psychologist. And elevating abdominal pain like eliminating obstructing factors. Escalate analgesia in a stepwise fashion. Refer to a pain management specialist. And for intractable pain, consider CT or EUS guided celiac axis block. Now, medical treatment includes nutritional and the pharmacological measures like diet management, which includes diet low in fat and high in protein and carbohydrates, pancreatic enzyme supplementation with meals, correct malabsorption of the fat-soluble vitamins and vitamin B12, micronutrient therapy with methionine, vitamin C and E, selenium, steroids, medium chain triglycerides, reducing gastric secretions, and treating diabetes mellitus. Intervention includes endoscopic, radiological, or surgical interventions for relieving the obstruction of the pancreatic duct, bile duct, or duodenum, and dealing with the complications. Decompressing an obstructed pancreatic duct, endoscopic pancreatic sphincterotomy, pancreatic duct stones may be extracted at ERCP, and pseudocyst may be drained internally under EUS guidance, and it can be drained percutaneously or transgastric under the USG or CT guidance. If the mass is in the head of the pancreas, for which either a pancreatoduodenectomy or a bigger procedure is appropriate. If the duct is markedly dilated, then a longitudinal pancreatojejunostomy or FREP procedure can be of choice. Other procedures include distal pancreatectomy, total pancreatectomy, and isolate autotransplantation. Now, complications includes pseudocyst, abscess, fistula, ascites, and variceal hemorrhage. End of the topic.